Announced that we now have 3,738 confirmed positive cases of COVID-19 in Kansas. That is up 247. We have 78 counties out of the 105 counties. That's up 2 from yesterday. And unfortunately, our death rate increased by 1 to 125. I will let Dr. Norman fill you in on details in a bit. But before I do that, I want to provide an update on the state's disaster declaration. Tomorrow, I will sign a new declaration of emergency effective through May 14th, at which point the State Finance Council of the Legislature can extend it for 30 days to June 13th. To remain in place beyond June 13th, the Legislature must extend the declaration by concurrent resolution. Replacing the current emergency declaration also requires that I reissue current emergency executive orders. So tomorrow, I will also issue one new executive order that will, in essence, extend the current executive orders under the new declaration. Declaring a new executive order will not require Kansas counties to take any additional actions, and we've been assured by our federal partners, including FEMA, that it will not impact any of our federal resources, including our funding. I have more details on what May 4th will look like tomorrow. There's no question that expanded testing for COVID-19 is the key to reopening the state and rebuilding our economy. And there's no doubt many parts of the state need stepped up capability to test Kansans who have symptoms. We have turned to private sector partners to help with this imperative. The goal is to provide testing closer to home for many Kansans, all while maintaining strict safety protocols. For our part, we have secured 500,000 USDA and FDA approved test collection kits from overseas. The first 5,000 of these tests has cleared customs and will be in the state shortly. We'll continue receiving an additional 10,000 testing kits every week until the order is filled. Our federal partners have also confirmed that they are sending another 25,000 testing kits this week and 25,000 more next week to assist in our efforts. Testing has lagged behind throughout Kansas, but the problem is amplified in our rural parts of the state where access to health care and testing is more elusive. These additional kits will expand our ability to test more Kansans, which will inform our decision-making process based on data as we move through the recovery phases. Earlier this week, FEMA fulfilled one of our resource requests with the Battelle decontamination system. The FDA-approved Battelle will sterilize and decontaminate N95 masks and make them safe for reuse by the healthcare workers who originally wore them. The system will reduce the shortage of masks by extending their lifespan. It will not replace or erase the desperate need for new masks. I know nurses and other healthcare professionals are concerned about this new system and whether it might mean we won't need as many new masks. It does not. I want to make sure everyone knows that we're still working diligently with federal and other sources to acquire masks and critical PPE our healthcare and other frontline workers will need now and into the future. Dr. Norman will discuss more about Battelle and its importance in his response in a few moments. Please know that we will not rest until everyone has ample and effective equipment they need to stay safe. This seemingly relentless virus continues to create a myriad of financial setbacks for Kansans across the state and has exacted still more pain for families already struggling to make ends meet. Today, our Department for Children and Families will announce a second opportunity for Kansans to apply for help with their winter heating bills through the Low-Income Energy Assistance Program. This second chance to apply for assistance is being rolled out to help those low-income families who may have missed the original deadline or have since experienced job losses or other new challenges during these trying times. The new application process for heating bill assistance will be in effect May 1st through May 29th. Details will be available on our new website, covid.ks.gov, and on the DCF website at lieap.dcf.kansas. Again, that's lieap.dcf.ks. As we look to cautiously and gradually reopen the state, we must also be mindful of the long recovery ahead for Kansans, their families, and our economy. Everyone has been affected in some way by COVID-19, so it's important to make sure we help people connect with the resources they need to stay safe and healthy. And with that, I'll turn it over to the Secretary of Health and Environment, Dr. Lee Norman.
Thank you, Governor Kelly. We're still monitoring the clusters, of course, and there are 55 throughout the state of Kansas. The 18 in long-term care facilities with 422 cases represented, including 69 deaths. 2 group living arrangements with 28 cases and 0 deaths. 1 correctional facility at Lansing with 121 cases and 1 death. 2 healthcare facilities with 16 cases and 0 deaths. 6 religious gatherings with 100 cases and 8 deaths. 20 in a variety of private companies with 170 cases and 4 deaths. And then 6 in the meatpacking industry in southwest Kansas with 451 cases and 1 death in Ford County, but it's a retired individual, not clear that there's any connection with the packing industries per se. As Governor pointed out, lots of good news on the contact tracing and testing front. As you mentioned earlier this week, we now have CDC staff here working with us in Topeka and some on the ground in southwest Kansas, assisting with work being done at the packing plants. We are also going to get 5 additional CDC staff to assist with surge needs throughout the state. They will be deployed with us for 11 months and assisting with supporting epidemiology, laboratory, and contact tracing. Contact tracing, we in discussion to hire 25 full-time contact tracing investigators and additional individuals to assist with contact tracing and data entry. As you can imagine, as we get an ever-growing number of positive cases, the increased amount of contact tracing required. You'll recall from the very first situation in Lawrence months ago now, had 403 contacts. So just to put things in perspective, that one person can have that many contacts that need to have a human contact made with them. Typically it's over the phone. Testing and supplies. The governor mentioned the 500,000 kits that are going to be coming our way. This is an example of what it'll be. This is where it all starts, is with, it's a swab, and it's the viral transport medium. And again, what we've been doing with our own fellow Kansans manufacturing the swab, and we manufacture our own viral transport medium. But this just, everything that can come into us through the supply chain just makes everything so much easier, so we don't have to divert lab staff over to work on this kind of stuff. We can then rely on vendors providing what we need. And the dentists have really come through strong, and we have the swabs we need now, and we're, to the governor's point, we're passing them out to local health departments, hospitals that have run short, so we're in pretty good shape about that. The Battelle machine. Today, Kansas Health Action Alert, otherwise known as a KHUN, went out to the healthcare providers with more details. Starting this week, the state of Kansas will have the Battelle unit up and running to decontaminate the N95 respirators. The N95s can be decontaminated up to 20 times through the system. And again, the advantage of using the aerosolized hydrogen peroxide is that it's kinder to the elastic and to the fabric and to the paper. So they'll get more use out of each one of the masks. And it also has very good user acceptability. Having been a clinician myself for over 40 years and worn masks for many hours, of course, in many days, it's important that user acceptability, and this passes our muster for having to be well tolerated by the users. And there's no mask sharing. The person gets their same masks back again, for obvious reasons. This program will be available, that is, the Battelle unit decontamination will be available and free to all Kansas healthcare facilities and first responders. An updated document will be shared later in the week, which more clearly outlines the transportation options for how to get the respirators to and from the decontamination unit itself, which will be here in Topeka. I thought I would share one more thing with you. It was in about mid-March that we did some forecasting about how many cases we were going to have, how many deaths there would be in the state of Kansas, hospital beds, ICU beds, and ventilators. And what we forecasted it for was on the middle of April, the end of April, the middle of May, and the end of May. And it has been very reassuring to me, and I know to the governor and our respective agencies and staff, that we've been essentially spot on in terms of where we thought we'd be, actually outperforming in many of these. When we talked about the range in 15 April and tomorrow will be 30 April, we are actually at the low end of the range of cumulative cases and deaths, which is good. We markedly outperformed on hospital beds, ICU beds, and ventilators. And the reason I think this is so helpful is that one of the things we want to do is to always right-size our response so that when we look at hospitals, healthcare facilities, staffing, purchases, acquisitions, that we have the right number with extra to spare of all those assets. And this way we can start now, I shouldn't say we started now, we've started weeks ago working with hospitals on capacity, on ICU, ventilators, beds, etc., surge, and how much overflow do we need. This helps us to do that with a great deal of comfort. That's in my prepared comments.
Okay, questions?
Mr. Secretary, can you talk to us about the situation at the Topeka VA hospital? They contacted you about the cluster, or did you hear about that secondhand?
They did not contact me. I heard about it from the county health officer here in Shawnee. There's really not an option about sharing information. That's a statute that drives that. So figuring that it must be a communication problem that could be remediated, I called to the second in command at the Veterans Administration, who was helpful, I think, in understanding that and helping people here locally understand that this is part of public health and is required by statute.
You think their excuse was red tape, or were they just trying to hide the fact that they had a problem?
I wouldn't, no, I haven't talked to them myself, so I really can't second guess on that.
Governor, I'm sorry to make you repeat yourself, but I wonder if you can explain again the executive order. So what you're issuing, are you saying that tomorrow you'll issue an executive order that extends the statewide lockdown for a few more weeks?
No, no, I'm sorry for the confusion. Tomorrow we'll actually be doing two things. We'll extend the emergency disaster declaration.
Okay.
Okay, and so that will go, that was set to expire Friday, the 1st, whenever the 1st is. So that was set to expire May 1st. So that is Friday. And so that will be extended by what we did, extending that to May 14th. The executive order that we will announce tomorrow will be essentially lifting of the statewide stay-at-home May 3rd midnight, and the phased-in reopening of the Kansas economy.
So that will lay out rules for what the reopening looks like.
Exactly. It'll set your limits for mass gatherings and provide other guidance for all counties, and then local counties can opt to put in more restrictive guidelines.
And you have the authority to do this without the limit. In terms of like where your authority is versus the legislature's authority, can you clarify that again, please?
Well, Are you talking about on the executive orders?
Yeah, on the executive orders, exactly.
Okay, on the executive orders, the legislature did insert itself into that process so that they'll have 3 days for the LCC to come together and review those and, sort of accept or reject. And then on the emergency declaration, the legislature also did insert themselves in there, but unfortunately, they would have to come back as a full legislature to extend that. And since they will not be back before the deadline, we felt it imperative to go ahead and extend the deadline ourselves. And we have been working very closely with our federal partners, including FEMA, and are very comfortable that this will not impact any of our federal resources, including funding.
And I can kind of look at this in a collective sense. This was a health problem, political, education, resource, economic. Now there's an exit debate about how to do this. Can you kind of put the whole crisis into perspective as it went through various stages?
Well, I see it first and foremost as a public health crisis. That is how this has begun, and that's how it continues. And clearly it has then the public health crisis in and of itself has created other crises, particularly economic. Both for the state as a whole, when we saw the consensus revenue estimates come in and tell us that we're going to have at least a $1.2 billion hole in the next two budget cycles, but also for individuals and their families. It's created economic crisis. So it's a crisis that has built on itself, and I would agree that it's gone from being a public health to being much more.
Governor, can you talk about, earlier you said you'd look at other states to what they're doing, if that's what's going to happen in Kansas. Surrounding states have put out plans already. Would you say yours is going to compare to theirs? Have you learned anything from what other states have done?
Well, we've had lots and lots of conversations over this whole period of time with various other states, either directly with the state or through the National Governors Association. And so we have collected all of what other states are doing and looked at that in putting together our own recovery plan. Just as we have all along, we didn't want to do something that was generic and a one-size-fits-all. It has to be Kansas-specific, but no doubt what we have put together also includes a lot of input from a lot of local stakeholders, a lot of local public officials, a lot of businesses from all different sectors, but also looking at what other states have done. Because some of them, this became an issue for them before it became an issue for Kansas. So some of them were already working on these. I could see what their experience was, and we learned from that experience as we were developing the plan.
Secretary Norman, from a health perspective, can you comment on the president's initiative to try to force packing plants to stay open?
Yes, I realize the question is forcing packing plants to stay open. I think that when one considers that that's a key part of our food supply, I think it's a very sensible thing to have done. I think it can be done safely. And I know there's been a lot of debate on both sides of that. We've been working all along with the companies themselves who very early on instituted the engineering at the work site for protections, gear that the workers wear, the screening for health conditions, touch base during the day multiple times, schedules so that they're not as much overlapping with people, break room management, etc. So I'm very comfortable with what they've done as corporations, what our local health departments have done in those counties by way of assisting the companies and working very closely. We've got CDC here on the ground helping. We've had NIOSH, which is looking at net safety and infection control practices. The fact that the president weighed in, or has an executive order to mandating that to us was good. It takes this debate off the table. We feel comfortable with it. It'll be a real challenge to still manage the community. But I think what they've done in their packing plants has been very high quality public health care.
The owners of those plants, are they bending the curve, or is it not known, or just too tardy to do that?
I think it's just too early to cases, I didn't do the addition yet. Yesterday, in those 3 counties alone, there's 1,040 cases. And now they're not all associated with packing plants, but the majority of them are. And we'll continue to add on more and more cases. And it's a paradox, I recognize, that the better public health work we do will drive more and more case identification. I'm going on down there, except it's a very unfortunate situation.
If I could respond to Tim's question about the meatpacking plants and the Defense Production Act mandate from the president. I just actually got off the phone. The vice president convened a call with a number of the governors, agricultural secretaries from both the state and federal level. CDC was on the call, and a number of the meatpacking CEOs were on the call. What was clear to me is that, we're already there. We recognize this as an issue, the ability to keep those plants in production. We saw the need for that because, Kansas provides 25% of, the beef across the nation, and then 25% or more across the world. So we recognized right from the get-go that there was a problem there. We had to go in and we had to do something about it. We did as a state, but I also credit to our federal partners, particularly the CDC, who came in like a SWAT team and got on the ground out in the Southwest particular, but also in Lyon County, and really we put together a system that allows us to do the testing, that allows us to do the contact tracing, and that allows us to provide the quarantining that's absolutely necessary if you're going to bend the curve on this kind of thing. So we're one of the only states where we didn't have to shut down a packing plant because we already had the systems in place to be able to work safely. So I think it's good news. And we've been actually helping other states. We've had several calls from other states. What did we do to prevent shutdown? So I'm confident that with the president's mandate that the other states and the meatpacking plants themselves will put into place the protocols that we've found to be useful.
Governor, what is the situation with releasing prisoners?
I keep saying tomorrow. I think this time I mean it. Tomorrow we'll be announcing that.
Governor, we received a press release earlier.
I'm sorry.
Governor, we received a press release earlier that said you plan on announcing your plans to reopen the state tomorrow at a local film studio. Can you talk about that and the reasoning behind you decided to do that instead of having this conference?
Well, the reason we're doing that at a studio is just because media needs and the ability to have this broadcast through a number of your stations and just the production quality and the ability to do it right. So we decided to do it there. I've been to that studio several times over many years, actually. But when I go now, that is when I appear on CNN, for instance, that's where I am, and we're socially distanced and all of the right things are in place so that it's safe, but it just will allow us to broadcast farther, wider, and clearer.
Governor, what are the county health people telling, maybe Mr. Secretary too, what are the county people telling you? Are you getting a very divergent message from Wyandotte County versus Brooks County?
Well,
What to do going forward?
The answer really is no. I think the counties overall really appreciated when we stepped in and put the statewide order. It really took the confusion out of that, and also took the onus of making those kinds of decisions off of folks. And I think they very much appreciated it. As we've been looking at reopening and lifting the statewide order, we've been in very frequent communication with our local public officials. Wyandotte County, Johnson County, Sedgwick County, and any other county that wants to have a conversation with us about that. So no, I think we've formed a very good relationship, and part of that goes to our public health officials because they're the boots on the ground. It's your local health departments and your emergency management folks, and I think they've been working very closely with our public health folks, Dr. and his team, and then our emergency management folks down at the ESC.
Dr.
minor. They have the same number of personnel and test equipment and swabs and everything.
To figure out what's
courier
going on
system.
at the meat packing.
Yeah.
Thank you.
Governor, the legs of the Kansas economy got oil, it's hurting, and oil prices are terrible. The ag markets are all screwed up, and now Boeing is cutting people, so aviation is going to take another hit. Do you think this effect on the economy is going to ripple around and last a long time? Years.
I think there's no doubt, Tim, that the impact of this pandemic on the economy, whether you're looking at Kansas or you're looking at any other state or you're looking at the nation, is going to be significant and could last for a period of time. When I look at the aviation industry in particular, it's had some real hits with the 737 MAX issue, and just the elimination of orders for things. We make parts essentially in the Wichita area for the aerospace industry, but and I'm really not free to talk about this here or now or really to anybody. But we're also working on some other things that are aviation related that we hope will offset some of the losses that we felt.
Governor, back to your announcement, will media be allowed there to ask questions?
No, it will not be open to the media or anyone else. The space just doesn't allow for that.
Governor Kelly, I guess to tag along to that then, there's obviously going to be some people that are just going to have complaints, no matter what the plan looks like. What it's going to look like. How do you quell those or squash their fears, I guess, that this is what's right?
Well, I'm used to that happening no matter what I decide. I raised 2 daughters, and so I could never do anything right for both of them at the same time. So I'm sort of used to that, but I think, I'm hoping that Kansans understand that through all of this, what we have had in mind is their health and safety. And so we made the tough decisions to shut down our schools for the entire year because we felt it was the best thing for Kansans. And I hope that they trust that as we're going the other way and we're starting to reopen things, that first and foremost in our minds is their health and their safety. That's why we're putting out detailed guidelines than, for instance, we saw from the White House. These are much more detailed. That's why we've been working with our local counties so that if they want to take these guidelines and ratchet them up, because for their specific area, they're not enough, they're not restrictive enough, local counties will have the authority to do that again. So, this is one of those, and for people to also understand that we are not going to take our eye off the ball. We're not going to open the door and then, go on vacation. We're going to stay there watching all along the way, measuring the hospitalizations, measuring the number of positive tests, measuring all of those kinds of things, and using that to ensure that as we move through these phases, that we're doing it safely.
Secretary Norman, we talked about hospitalizations and deaths last time, kind of percentage of those. I looked at the numbers, at least both of them have been going down since about April 21st, percentage-wise. Is that what maybe the peak you guys are looking at is? And that would be almost 2 weeks until. Is that kind of what you guys see?
Yeah, I think I can pretty comfortably tell you that we've peaked out in terms of the burden of the disease. And again, this nuance of increased testing is still finding ongoing new cases. We'll show you some things on Friday. We're having some, we want to close out the month of April, and we should have on Friday some large graphs to depict the activity in cases and hospitalizations and deaths that I think will be very telling. The one thing I might add is, and I've talked about it before, we measure influenza-like illness, and COVID-19 is a like illness. We still measure that all the way up until May. And we know the amount of influenza is dropping. We're almost seeing no influenza tests are not coming back positive for influenza. We're still having COVID-19, obviously, but those numbers are dropping off too. So the whole influenza-like illness, by the way, that's on our, if you look on our website, we have that always kept current. That graph is dropping like a rock. So we're going to see a continued tailing off with COVID-19. There's no question about it, but the numbers are improving. We'll show you those on Friday.
Is there any reason deaths and hospitalizations should go up or could go up after the stay-at-home order is
well, honestly, if the go up, that would be a worrisome thing. And that's why this is in a phased-in manner. I think people will need to, because the question is, what's the new normal going to be? Not just new normal next week, but next month and next year even. And I think you'll see the plan that for the strength, I think, is that it's phased-in process where people will ease into the new normal. So we would like to, and I don't think we're going to see an uptick in the spring and summer. That would be considered worrisome.
Governor, do you have a response to the 10th Circuit Court of Appeals ruling that the state's proof of citizenship law is unconstitutional? Do you think the state should drop its appeal?
Yes, I do think the state should drop its appeal, but that decision is not up to me. I think that what it tells us is what I've thought for a long time, is that we ought to be doing everything that we can to encourage voting. If we have a problem with voting in the state of Kansas and across the country, is that not enough people exercise their right. So I think eliminating any barriers to voting is a good thing.
Governor, I apologize if you already touched on this, but what do we know about whether workers in the meatpacking plants who test positive for coronavirus are continuing to work, maybe with masks on?
I'm going to let Dr. Norman take that question.
Yeah, people who are ill, the question is, would there ever be a situation where somebody who tests positive for the coronavirus 19 be allowed to continue working? The answer is no. They will, an ill person, whatever kind of ill they are, or a person that has a documented positive COVID-19 test will be home on quarantine and isolation.
Including asymptomatic.
If they test positive, yes, they will not be working in the plant. If people are asymptomatic, meaning if they're well, but they've been exposed to somebody, that's what the order allows to do, which is to put on proper protective equipment and to work with all those other districts in place. Basically what it makes them is just like healthcare workers and first responders. It's the same rules apply.
Could you both step into the Lansing prison for a second? Excuse me. And talk about the healthcare. I don't know if there's social distancing going on or whether the healthcare provided is sufficient. I think there's some real anxiety for people who are incarcerated and their families. Can you talk about what's going on there? Is the National Guard serving as security in the prison? Can you just explain what's happening up there?
Well, I can tell you, Tim, that are people socially distancing all the time in our prison systems? No, it's just not an environment that allows for that. So what Department of Corrections has done is do as much as they can to ensure that there's not a lot of excessive mingling of folks. So they've established these cohorts, and they move a group from one area to another in the same cohort. So they're only being exposed within that small cohort, rather than bringing everybody together and having hundreds of people mixing together. So I think they've established what they can. We did have the new facility that was there, where we moved folks who were positive or symptomatic from the old facility into the new facility, which allowed us to provide quarantining and stuff. And so we were able to do that when this first wave hit. So that's happened. I'm going to give it to Dr. Norman to address the issue of medical care that's being provided at the facility.
Sure, thank you. In answer to your question about the National Guard, no, they are not there as a security force. They are there. They're mostly combat medics that are being used for doing medical evaluations and testing that are laboratory tests that are sent in. Well, today will be a very interesting day. We brought from one cohort of the unit, as the governor pointed out yesterday, we sampled 239 offenders in that unit, whether they were symptomatic or not. They were generally been not symptomatic because, and then we'll find out, is it 20% of the people are positive? Is it 10%? Is it 55%? That's what we've been waiting for these things all along in order to do the public health population sampling. And that happens to be one population of people that are at higher risk for the exact reasons you asked, which you cannot socially distance as much as you'd like to when there's bunk beds.
Can inmates decline to be tested could that mean that the incidence of this virus in the prison is higher than what is known?
We did have one offender that declined to be tested and therefore was isolated, even though it was the person was well, without symptoms, was isolated away in quarantine, so because we couldn't say whether they were going to be positive or negative.
Governor, with the unemployment, people calling us saying they're having issues with unemployment, is this a system problem still, or more individual? We're still getting those calls.
No, it is still a system problem. You know, we have been able to patch together the system in a way that it was able to be much more responsive. We increased the number of applications that we could process at any given time, but that by no means means that there won't still be delays in the system. So what we have consistently encouraged people to do is, one, try to go online if they have the ability to go online to file for unemployment benefits. If they can't do that, then when they call and stay on the line. And don't hang up and keep calling back, because you just get put further back in the queue. So, online is best. Calling and hanging on is second best. But while it has gotten a whole lot better, including, I think, our ability to actually issue the $600 checks that came in through the stimulus package, that required setting up an entirely different platform. I think we've got that in place, and that's working. Is everything working perfectly? No, and it won't. I hope if we take nothing else away from the unemployment situation, I don't want to say from the pandemic itself, but that it's imperative that we invest in our infrastructure to be able to deliver services to the folks in Kansas. And so we can't really do that right now because we're in the midst of flying the plane. But as soon as we can land, we need to make sure that we then fix it.
Thank you.